Great. Well, welcome everyone to the November 9th edition of the COVID-19 update. I'm so happy to be back. I can't even remember what I was doing 2 weeks ago, but missed being on the call. Okay, so just a review of COVID community levels. This is just kind of an up and down and up and down. And at this point, probably everyone's gotten the message, but in kind of in our neck of the woods, definitely we're seeing an increase in cases overall. And again, this map is looking at case counts as well as hospitalizations. And what most of the time happens is first you see the increase in cases, and then oftentimes increases in hospitalizations, and then increase in death follows. So this is just kind of the beginning of that chain, starting to see those cases go up. So overall, I mean, I always find this a very interesting map because it's green. Overall it's very green. It looks very reassuring, but it doesn't always fit with what we're seeing in the community. Then this map is kind of the opposite. This map is looking at the cases and percent positivity, and it looks all bad, maybe worse than we actually feel like it is. But it's just two different ways. It's looking at two different metrics or two different ways of measuring how much COVID is around. This is the map that healthcare facilities are supposed to use for determining whether their staff masks or not. So a couple of probably months ago at this point, the CDC said it's not required to mask in healthcare facilities, that healthcare facilities could set their own rules about that, but they definitely recommended that when community transmission, when you're in a high level of community transmission, so if your healthcare facility is in a county that's in the red, then everyone should be masking. That was their strong recommendation. Okay, so looking at just New Mexico specific data, this is just a case count by week, and you can see that we do continue to go up. So we hit a real low point in cases at the beginning of October, end of September, and we have been slowly on the rise since. And that rise is actually, interestingly, not really driven in most places in the United States by the variants, but I think there is a worry that that is still to come. So this is the variant tracker, and it's a little bit confusing, but it basically, I mean, we've looked at it before. We look at it by week, and the weeks are down here at the bottom. So as of the week ending 11/5, you can see that BA.5, which has been the variant that we have been battling for really from like beginning of July, and most of the summer we dealt with BA.5, and then it slowly has been decreasing. So now BA.5 is making up less than 50% of cases across the US, and that is a big turning point. What we see coming in is a bunch of, I mean, I keep trying to think of the right analogy for it. It almost feels like, like a big playoff basketball game or something. But we have all these variants popping up, the BA.4.6, the BQ1, the BF7, the BQ1.1, and then a few others. They're all listed here. But what looks like the one that's maybe the most worrisome is the BQ1.1 and the BQ1, because they are gaining ground, they're gaining percentage. And as a combined percentage, they're over 35%. And this is, again, across the US. This is not just in New Mexico. But if you do look at New Mexico specific data on variants, we do see the BQ1 is here in New Mexico. So we never know for sure what's going to happen. Sometimes they pop up and fizzle out, but definitely worth keeping an eye on. And one of the things about the BQ1 series is that it does look like, once again, they have some ability to, some immune evasion. So some ability to make you sick, even if you've had a prior COVID infection that should help boost your immune system. And even if you've had, if you're fully vaccinated, you could still get the BQ1. But just a reminder that vaccine, even if it's not a perfect match, still helps prevent the worst outcomes from COVID, so hospitalizations and death. So anyway, that's kind of a more to come. We'll have to see. We'll have to see what happens over the next few weeks on that. One other thing I want to say about the BQ1 variant is that one of the infusion medicines that we use, the monoclonal antibody, isn't really effective against BQ1. So that's another potential change. If that BQ1 really gains ground, then we will probably lose the bebtelovimab, that last monoclonal antibody that we are using right now, won't be able to use it in the treatment of COVID. Okay, so this is, and I should just say, if you guys haven't seen the, I know there's lots of resources that Liesl has put together. This does remind me about the toolkit that's on the main page of the DOH website, which Liesl also designed and has been updated and looks fantastic. And you can even like print individual pages of it or look at it as a whole resource. And I think the main thing here is just, and I'm sure everyone has this message already, but not everyone in New Mexico has the message that people ages 5 and over are eligible for that Omicron booster. And we can come back to this if we want to look at it in more detail. Then there is a separate schedule for immune compromised. But one of the nice things about the Omicron booster is that there isn't quite as many different rules for different groups of people. So also for people who are immune compromised, 2 months after you finish your primary series, you're eligible for that Omicron booster from everyone 5 and older. The difference for immune compromised, once again, is that immune compromised people get a 3-dose primary series. And I know we've called it lots of different things, an additional dose, the immune compromised dose, but really we're coming around to looking at it as 3 primary doses. So if you're immune compromised, you get 3 doses as your primary series, and then 2 months later can get that Omicron booster. And there were all a bunch of other booster recommendations before for immune compromised people, and those have all gone away. You don't have to get those. You just jump in here with the Omicron booster. If you did get all of them, great. Once again, just jump in 2 months after the last dose you got with the Omicron booster. And then the little guys, 6 months to 4 years old, probably an Omicron booster is coming for them, both immune compromised and not, maybe early in the new year, but right now it's just trying to get them immunized for start, getting the primary series in. Okay, so finding the monoclonal antibody treatments, and this has gotten increasingly difficult, but this is a good resource at cv.nmhealth.org, this /treatments. One thing that we did just learn is that Presbyterian here in the Albuquerque Metro is no longer giving the bebtelovimab and the remdesivir, the infusion treatments. So that does mean it is less available. It's largely available in ER kind of situations. And again, this is the medication that we may not be able to use if BQ1 becomes our most common variant. For Evusheld, which is not a treatment, but a preventive monoclonal antibody, for right now, we are, that really does go through more a clinic-based setting. So people who qualify for Evusheld are usually in specialty care with either a transplant doctor, a rheumatologist, an immunologist, a pulmonologist, and they should have access still to the Evusheld. Okay, so moving on to respiratory syncytial virus, or RSV. It's a common respiratory virus, and it usually just causes mild cold-like symptoms. It's been around, this is not new, it's been around for a long time, and most people don't even really know that they have RSV, like healthy adults. It's really where we have always focused on it is in little kids. So usually around January or February, there's suddenly kind of, you know, a statewide outbreak of RSV, lots of little kids in the hospital. It often gives them kind of a wheezy, crackly sounding chest and cough. But this year, what we've seen is RSV much earlier in the winter season. And then the other group that can be affected by RSV is the elderly. So they can often get kind of a very bad cold, or even kind of bronchitis, pneumonia type of thing from RSV. So the symptoms of RSV, again, usually a lot like a cold: runny nose, decrease in appetite, coughing, sneezing, fever, and wheezing. And a lot of times, like if you were just to walk in to see your doctor as a kind of middle-aged, healthy person, they're not even going to bother testing for RSV. They just say you have a cold, go home and take care of yourself. It's the little kids and the elderly that often end up where, especially if they're hospitalized, getting tested to try to find out, is this flu, is it RSV, is it COVID, is it some other respiratory virus? So RSV can cause more severe infections such as bronchiolitis and pneumonia, especially in that group of kids under a year old. Sometimes it's like 2 years old, but what we've seen this season is really sort of between 1 and 5-year-olds getting hospitalized for RSV. And the going thought about that is just that overall, as a community and society, we have less immunity to RSV, just because for the last couple of winters, everyone's been masking and no one got RSV or stayed home. So they're not, you know, not in daycare, kind of trading germs. So hospitals are now in New Mexico and really across the US having more cases of children with RSV. Most children are exposed to RSV when they're infants and then create antibodies early in their life that protects them for the rest of the early years. And then again, like lots of other diseases, we know immunity can wane, but this is often kind of late in life, which is why the elderly are again much more susceptible to getting RSV. So COVID safety measures the past 2 years might have prevented children from getting this exposure. And then I just sort of love this: protect your child from RSV. So avoid close contact with sick people, cover your coughs and sneezes, wash your hands, clean and disinfect surfaces, avoid touching your face, stay home when you're sick. And, you know, this is just great advice for RSV, for flu, for COVID. I mean, it really is kind of the universal respiratory virus kind of bag of tricks. So flu basics, and this, and Liesl, I don't know if you want to jump in about the trusted messenger training, or do you want me to just read the slide here?
Yeah, I just included it because I got an email with this information that Presbyterian Community Health is offering this training. So it's free, it's virtual, in English and in Spanish. So if anyone's interested, there's some information on this slide, and I can also put the flyers in the chat.
Great. Yeah, it looks really like a good program. And interestingly, I think there's been a little bit better uptake in flu vaccine. And I don't know what you guys hear in the community, but that sort of ease, if you're going to get a COVID vaccine and they offer you flu, it's sort of easy just to say yes to both. And then I think there is some worry that this will be a rough flu year. It definitely has started a little bit early. And then in the Southern Hemisphere that has their flu season during our summer, overall, it was a very active flu season, kind of differed in different parts of the Southern Hemisphere. Okay, monkeypox, this is quick and easy, but you know, there have been a large number of cases in the US, 28,657 reported cases and 51 cases in New Mexico. But look at this beautiful curve. The cases peaked, they've come down. We had two big interventions for monkeypox. One was vaccine and a very willing group of people to get vaccine. And the other is some, you know, this was a disease that landed in largely the MSM population. It's a very connected group of people that made changes and got a lot of education out. And so some of the behavior changes that happened also really impact this decrease in cases. Knock wood, I think we've had maybe 2 cases in the last 3 weeks in New Mexico. So I think everyone in New Mexico and across the US is really hoping that we can drive this to 0. So we'll wait and see, but it's really headed the right direction. And you know, kind of inspiring, I guess, of what can happen if people, and then the disease was a little bit easier to fight because it's a little more slow moving than like COVID. There weren't all these new variants coming up. This is the monkeypox weekly report that gets posted every week on the website and just gives the information about monkeypox specific to New Mexico, who's getting the cases and who's being vaccinated, and hasn't changed much in the last couple of weeks. And then last comment here on Be Well New Mexico, which is the insurance marketplace where New Mexicans can compare plans and enroll. So it's open until January 15th. So, and Liesl, thank you for tracking down this information, but as many as 4 of 5 applicants may qualify to pay less than $10 per month for healthcare coverage with federal and state subsidies in place. So again, if you're someone who doesn't qualify for Medicaid, this is some place to look for reasonably priced insurance. And if you're not getting insurance through your employer, but sometimes even employer insurance is very expensive. So this gives some other options. November is also National Diabetes Awareness Month, something I'm sure everyone does encounter quite a lot in the work that you do. So, and thank you for all that you do. This is the last slide and I'll stop sharing and see if there's any questions.
Good morning, or good afternoon, I mean. So we're encountering an issue of when we go out to do vaccination clinics, we usually partner with our public health nurse, but they only do the Pfizer Omicron booster. And a lot of our people are requesting that they do the Moderna because that's what was primarily done out there in our area. So do you know of how I could get that resource out, Moderna out there to them?
Where are you in the state?
We're in Torrance County.
In Torrance County, okay.
Yes.
I think probably the best would be reaching out to Maxine, who could connect you potentially with PMG, which is
okay.
a contractor that has them. And there was like a kind of generic URL that I've forgotten, but I guess we could even just, we can put her email in the chat.
Okay.
I wouldn't mind that. And yeah, let you try that. And just to be clear, it is totally okay to mix and match them, but I know that what we bump up against is people who have a lot of brand loyalty or just kind of fear of like, I know what to expect with my Moderna, so I don't want to try a Pfizer and vice versa. But you know, I think as the years go on, probably it will be like flu, where you have no idea what brand you're getting. You're just like, you know, just give it to me. So, but we do have some resources. And the other thing is I know the public health nurses, like that is largely what we've given. If there's no rule that they couldn't stock Moderna. So maybe we can, you know, if that's really a big need, we also could look at just chatting with them about whether they'd be willing to stock both.
Thank you.
I also just want to say that I did learn that Pfizer is in the very beginning stages of testing a Omicron booster combined with the quadrivalent flu, which will also make life a lot easier. But it won't be obviously for this season, but they are trying to get a combo shot so people can get just like one winter vaccine.
Thank you. Sarah, do you want to ask your question?
Sí, hola, buenas tardes. En este momento estoy pasando por que di positivo a COVID. Tengo aproximadamente una semana. Y mi pregunta es que ahora que yo estoy pasando por esto, fue muy difícil toda una semana. Yo vivo acá en El Paso y traté de agarrar mis antivirales y en las farmacias me preguntaban por mi médico primario. En fin, no me pudieron dar a mí los antivirales aquí en Texas. Y tuve que ir y recurrir con mi médico familiar en México. Él me recetó un antibiótico, pero no he podido tener mis antivirales porque no tengo, yo creo, no estoy registrado. Mi médico primario ya no es mi médico primario y estoy en proceso de agarrar una nueva aseguranza. Y no sé si esta ley o estas leyes son aquí nada más en Texas o también en Nuevo México. O si puedo recurrir a Nuevo México, que me queda cerquita Las Cruces, Sandon Park.
Thank you, Sarah.
Okay. Sarah's translate. Okay, in this moment, I'm COVID positive for the past week. And my question is, as I'm going through this, it is very difficult. I'm trying to take my antivirals, but the pharmacy asked for my primary provider, so I can't receive my antivirals here in Texas because of that. So I'm trying to get from Mexico my primary doctors. Okay, so there is really the only rule about antivirals, the Paxlovid, the oral one, is that you have to start within 5 days of symptoms. But you don't, and then for a pharmacist to prescribe, there is a rule that they have to review lab work within the last year, which makes, that's not really that useful. But for a doctor to prescribe, or a nurse practitioner or a physician's assistant, they don't have that same rule that they have to, they know that you're basically a healthy person without kidney or liver disease, they can prescribe. And so in New Mexico, and I don't know how many days you're into this, or you're into the illness, but I did just learn that if you call the hotline, the COVID hotline, and say that you're having trouble getting a prescription for Paxlovid, that they will send you over to the, they do have some pharmacists, and then, then we are back to that problem where they have to review. But if you are someone who's had labs in the last year, they can take a look at those and then just call you in a prescription. You don't have to get seen. So it's not perfect for everyone, but sort of one option of trying to expand the possibilities. And then, and again, this would is maybe more New Mexico specific information, but if you, there are some telehealth options where you can get on and do a telehealth visit. So at least you don't have to get your primary. But there's definitely no rule that it can only be your primary doctor that prescribes. Lots of people don't have primary doctors. And in New Mexico, I think urgent care prescribes a fair amount of Paxlovid, which is another option, going, you know, getting seen in. Does that answer the question? Let's see.
Thank you.
Yeah. It's definitely a little more complicated on the, for the infusion medications, so the monoclonal and the remdesivir, but the biggest problem there is just there are not a lot of places that are giving it right now. But same thing, I mean, an urgent care can definitely prescribe those for you. So it does not have to be a primary care doc. And sorry that you're having trouble with that and not feeling well. Yeah.
Yeah, we hope you feel better soon. That's really hard. I know a lot of people with COVID right now too. Yeah, seems to be going around.
Another interesting thing that came up, and not to make anyone feel bad who didn't get the Paxlovid, but there was this big VA study, you probably heard about it, the Veterans Administration, that did show that one thing about taking Paxlovid, if you are someone who's gets COVID and is at risk for having a severe case of COVID, that if you take the Paxlovid, it decreases the chance of long COVID. So I thought, you know, that was also hopeful news, except for if you can't get Paxlovid, it doesn't do you any good, but at least the science is moving forward a little bit on how to prevent long COVID.
Are there any other questions? You can raise your hand or speak up or type it in the chat.
Hi, Dr. Miranda. This is Ife. I have a question, but you may not be able to answer it. And my chat will not allow me to write anything in it. I don't know what's happening there. As was just said, there is a lot of COVID, whatever it is, Omicron, BA1 or Q, but there's a lot of people that I'm dealing with right now who have COVID or have RSV or have something, and the doctors say that it's not the flu. And why are we not seeing that reflected in the CDC or even our Department of Health saying, hey, this is what's going on right now. People need to be more cautious, or reminders. It just seems like everything has just been thrown by the wayside and you got to fend for yourself. A lot of people are really frustrated about that. And I just heard this lady there in Texas, the community healthcare worker there, where it's like we're trying to say this isn't going on anymore. And it is. You might not be able to answer that question, but why?
Yeah, it is discouraging, or I would say it feels like the balance isn't quite there. Like, you know, we were kind of way into kind of restrictions and required masking and lots of requirements. And then it feels like it kind of swung the other way. Like, we're just going to let go of all these things. And I mean, really what I keep thinking about masking is there's a ton of good reasons to mask. I mean, there's not just COVID, but flu. And at least where I worked in Indian Health Service, like if you didn't get a flu shot for the winter or by Halloween, you had to mask basically through the whole respiratory virus until Department of Health declared the flu season over, which sometimes was like May. So, you know, we kind of used to have masking, then we really had masking with COVID, but there's still just so many good reasons to mask and be careful. And, you know, and I think what is maybe nice now is being able to use some reasonable judgment, even though maybe not everyone does that. But, you know, if you're out for a walk with someone in the air, like, okay, you know, that's not a situation where you have to wear your mask unless that person is coughing all over you. But, you know, when you are in a small work environment in the middle of winter, you know, masking makes a lot of sense if you don't want to be out for a week with whatever it is, COVID, flu, RSV, the common cold. So I'm hoping, I mean, I feel like a lot of things do kind of swing back and forth, and then we kind of come to a message that's comfortable, but I would concur. And there's also often a lag, like we start to see cases go up and then things kind of kick into gear. People start getting vaccinated again and tested again. And I think it gets harder and harder for people to rev back up. You know, we saw those cases come down. Everyone was like, yay, maybe we won't have a winter surge, you know, at the beginning of October. And it does seem like we kind of all know it's happening, but I agree there's not a lot of messaging about it. So I don't really have an answer, just I feel your pain.
It feels like there's an elephant in the room.
Yeah.
And we aren't sure if anybody's going to notice that he's sitting on people. And so basically the question I always have is, how do we even know that if there's something really going on, that they're going to say something to us? Because, you know, we had the president say, well, the pandemic's really over now. And I was like appalled. So, but yeah, I didn't think you'd have an answer, but I do mask up, and I advise everyone to, but a lot of these people are fully vaccinated and they have good immune systems, and they're still down with all of this. So it's concerning, but thank you.
Yeah, and I think, I mean, it's not efficient compared to like being able to message out through media, but I think, again, sort of that like us staying in touch with each other and sort of being sure we're all clear about where, you know, our epi department kind of puts together graphs, we take them and try to, you know, it's kind of more of a grassroots, I guess, but I do think, you know, all the more important the work that you guys do to make sure that people are aware of what's happening, because it's not really in the paper anymore and it's not on the news. I mean, I think it actually made the news that our hospitalizations were up, but, you know, it's not like it was. There is also a very interesting flu map, which we can show next time on the, I mean, there's some on the Department of Health website, as well as the CDC, but like the whole swath of the southern US that goes kind of from New Mexico to Florida is like definitely high activity. So anyway, that sharing resources so you can point to things, it's not just your opinion or how many people you know that have a viral illness, but you can kind of share some of these resources. I think it's really valuable.
Thank you.
Thanks. And I see in the chat that somebody asked about when they can get the Omicron vaccine after having COVID, and that was answered. Thank you, Maria. It is 3 months after your symptoms start, right, Dr. Miranda?
Yeah, and that's not a hard rule. That's kind of like, so if you, let's say you were going to travel somewhere and you really wanted to get that Omicron booster just kind of on board, it's really from any time after you've recovered from COVID up to 3 months. And you know, having gotten COVID does protect you. So you're sort of safe to wait that 3 months. But again, sometimes, I don't know, circumstances happen. It would be okay if you got it sooner than that. Now, let's say we have another variant and suddenly it seems like it would be a good idea to get it sooner, you could do that.
Another question is, does anyone know where there are free flu shots for the peeps that are uninsured?
Department of Health. So really I would always call first, because some of our Department of Health offices don't have staffing every day, but in every, and they're probably not all perfectly located, but that would be a good place to start because they all do give free flu shots. And I don't know if any of you guys work in like FQHCs, there's probably usually like a small fee for getting a flu shot, right? Or do you guys have information on that? I don't know. I see some people from Casa de Salud. I don't know. So not really an FQHC.
Here at Casa de Salud is, sorry.
And Brian?
Here at Casa de Salud, it's free if you have Medicaid, or $25.
Okay.
Private pay.
Okay. So, and there are there are also like outreach events, I know, and I don't know, I saw Brian pop on. I don't know if you wanted to say, yeah, go ahead.
Yeah, and I'm pretty sure that there's going to be a vaccine clinic this Saturday at Expo, New Mexico. It'll be held by Presbyterian.
Okay, yeah, I was gonna say, I know Presbyterian does have like community outreach events that are free, and maybe this is a good take home that we need a little more like visibility on that resource. So getting things, making it clear to people where they can get a free flu shot. And usually I think Presbyterian organizes COVID and flu together if they can get enough vaccinators. So.
Are there any other questions? We also do have a very, very short one slide presentation about the behavioral health equity community health worker partnership. So unless there are any other questions, we can hand it over.
Can I speak?
Yeah, absolutely.
Can I make a comment?
Mm-hmm.
This is Dr. Bernal from Salud Morena. There are several things that I want to say. The last one that you were talking about, free immunization for COVID, Walmart offer free COVID, and it's the Omicron, and flu vaccine. So you can get in touch in your neighborhood Walmart too, if you are far from another places, number one. Number two, the comment, thank you so much, Dr. Durham, for all the review of the epidemics that we have right now. Definitely it was thought, and it was a concern that being in the winter, that we are more confined in places, influenza and other viruses besides the COVID were going to increase. And as she said, Dr. Dunn, the mortality didn't increase, but the morbidity did increase a little bit. So we have to be aware of continuing the prevention steps that we had before, and to stress the Omicron immunizations for the people that need it. About the other comments that she made, as you know, I am a pediatrician, and our concern during the winter was the RSV in the past, with increase of morbidity and mortality in children below 5, especially below 2 months, and in prematures. Is an illness that killed babies. And we saw in all the information of many hospitals that they were packed by respiratory illnesses, not only the RSV, but also the influenza. And personally, my grandchildren were very sick for a week and a half with high fevers. They were negative for COVID. They were both immunized, but it's a combination of viruses. the flu was negative, but the RSV was positive, although they are above 5 years. Definitely, RSV can be in any age, but hit more and the morbidity is more in children and geriatrics. So the grandma like me that were coughing too much, we have to be careful that this grandma will not visit the premature grandchildren because they will be, their risk of mortality is high. And is a disease that they can wheeze for a long time, up to 3 months sometimes. And some have some sequela that produce respiratory, a kind of reactive airway disease for several years. And especially is aggravated during the winter time. Fortunately, I was looking that probably for next year, we will have also immunizations for RSV. That is a very good news. So that is my comment about RSV being a pediatrician. It's a severe illness, morbidity and mortality is high in children below 1. Thank you so much.
Thank you so much, Dr. Burnell. All right. Before they have to go, I'm going to hand it over to Daniela to give us a very short presentation, and I will share my screen. Let me get that up.
Thank you. Hi, everybody. I see a bunch of familiar faces and names on here, but my name is Daniela Matthews-Trigg. I'm with the Vaccine Health Equity Project, and I'm going to be sort of spearheading the launch of a new funding opportunity and a new grant that we're going to be starting called the Community Health Worker Partnerships for Behavioral Health Equity. So it's going to be a sort of a sister program to the existing vaccine equity program. So you can click, perfect, thank you. So the goals of this new initiative, this new program, is to increase behavioral health access and knowledge throughout New Mexico and all different communities, similar to sort of how many of you, all of you here, are working within your communities to spread information about the vaccine and COVID. This program will be focused on behavioral health. Increase awareness of behavioral health and wellness resources in different communities. A really important piece that we want to really prioritize is destigmatizing mental and behavioral health issues and destigmatize the conversations around that. And also to provide accurate information to community members and connect them to behavioral health support services. Another important piece that we're going to be doing in this project is asset mapping and sort of working within communities to identify what assets they have, what they need, and then working to advocate to fill those gaps. So right now, the application for organizations to apply for funding is open. It's open through Wednesday, November 16th. So it's a pretty short sort of window that it's open, but the application itself is pretty straightforward. My advice to any people or organizations applying, don't overthink it. That's my advice. Just don't overthink it. So if you are interested in learning more, or if you think there's someone at your organization who might be interested in this and would like to learn more, we had an info session last week. Unfortunately, we will not be having another one, but we did record it. So the link at the bottom of the slide has the recording on YouTube to the info session. So that really goes over all of the kind of information about the program and information about the funding and the application. So if you have any questions, that's where I'm going to send you. And then if you have any sort of additional questions, if you want to talk about it more with your organization, and then want to chat with me about it, please reach out. I know you can't access links on a PowerPoint, so I'm going to copy and paste all of those links, my email, and I'm going to put it all in the chat so you can go access it there. But that's about it. Short and sweet. Please reach out if you have any questions. Thank you so much. Thanks for having me.